My name's Ilan Lieberman. I'm a consultant in pain medicine. I have an interest in fibromyalgia. I've developed the fibromyalgia app and I've done a series of videos. This video focuses on a subject which might sound a bit challenging. What to do if your doctor doesn't believe in fibromyalgia or doesn't want to talk to you from your perspective because you have fibromyalgia. Now, clearly, that's a very difficult position to be in. There is an asymmetry in power between the patient and the doctor. And when a doctor appears not to be interested, that can be a very, very negative experience for the service user, for the patient, for yourself. And actually, I just want to apologize if you find yourself in that situation, because in my opinion, that just shouldn't happen. You're the person with a problem. You shouldn't be faced with a healthcare professional who's not interested. That's a really difficult situation. But I'm going to try and unpick why that might be in this video to help you get the best out of your health interactions and your consultations that you inevitably will have. So let's try and understand why your doctor comes across that way. Now, it's not because your doctor doesn't care or your healthcare professional doesn't care, and it's not because they're not interested in you. What it probably is, in my opinion, is that they don't feel that they have the tools to help you. They're a bit burnt out with the problem. And they feel frustrated internally that they can't get you what you want. Now, that may be because of lack of education, they don't understand the subject, or it may be because they feel that there is a lack of local resource to manage the problem. But you can solve for all of that by walking them through it as a service user and by encouraging them to understand things. And also by asking the right questions and asking for the right bits of care. So you need to try and make it easy for the doctor. And I know that sounds like a really crazy thing to say because they're there to care for you. But let's be realistic about that. You need to make it easy. So I'm assuming here that you have a diagnosis which you understand about. If you don't understand your diagnosis, that's a different matter. And I've done some videos explaining what fibromyalgia is and how to get a diagnosis around that. So we're assuming here that you know your diagnosis, but where you are is you're frustrated with your care in the pathway. So the first thing is, understand that your consultation is going to be short. It's going to be between 5 and 15 minutes. If you're in a pain clinic, it might be longer, but a GP consultation could be between 8 and 12 minutes, if that sometimes. So go in with one problem you want sorting out rather than lots of problems, and be clear about articulating about what your one problem is. But don't give them a problem that's so huge that they're going to have to boil the ocean to sort out. So it might be that you want to talk to them about the medication that you're on. For example, the gabapentin you feel is making you put weight on, or is fogging your thinking, or is making you dizzy, or disrupting your sleep, for example. So if there's a single thing that you can identify, chop up your problems into small things that a doctor can solve for at each consultation, because you can keep on going back. And if you just ask for one thing to be solved at a time, that's much easier for a doctor than to just go in and go, it hurts everywhere. What are you going to do about it? Because that is a bit of a death spiral. So identify your problem. And if you have 10, write them all down. Talk about that with your friends and family. Draw up a list. And then order that list in terms of which problem is the easiest one to deal with, which one is the hardest one to deal with, which is most impactful into your life. And then choose one to get the doctor to sort out at a time. That way, I think you're going to get the best out of that particular consultation. Now, the other thing around that consultation is you're allowed to prep around it. And we live in an age where there's lots of information available. So I don't think there's anything wrong personally by going and looking up your problem on GPT, arming yourself with some questions to ask the doctor when he offers you advice, explaining that you're not grilling them, you're not giving them an exam, but you are becoming the expert in your own problem. So understand from your perspective as a layperson what you think the problem is. And in a kind way, when you're discussing this with the doctor, say, look, I've read around the subject. This is what I think. What do you think? Not GPT disagrees with you or Google disagrees with you. That will put someone's back up. So just say, look, I've got this problem with fogginess of thought. It looks like on the information leaflet on the drug package, or from what I've read on the internet, it might be this drug or it might be this problem. What do you think? Now, that's perfectly reasonable. And most doctors do exactly what you do when they've got a problem. If they've got a problem with their car, they will put the make and model in, talk about the problem, and expect the GPT to give them an answer. If they go away on holiday, they will more than likely ask the GPT where they want to go on holiday to and the best restaurants around. So it would be unreasonable for a healthcare professional to consider that the patient's not looking at things. But it needs to be a two-way process of engagement and understanding. And that's the way it doesn't challenge people, but it gets the best out of the consultation. So as the consultation's going along, if you've written stuff down, you can refer to it, because in the heat of the moment, it can be challenging. And the last thing you want to do is remember what you wanted to ask on the corridor once you've left the room, because you can't go back in. So as the consultation's going along, say, look, I've thought about that. What do you think about this? If they say something to you or dismissive, say, look, I don't want to disagree with you, but I just feel that we just need to talk about this one little thing a little bit more. I'm aware that there's not much time in the consultation, so please can we focus on it? If you talk to people slowly and rationally and reasonably, they will give you decent responses. All doctors go to work, all clinicians go to work wanting to look after people. They are under huge amounts of time pressure. Make it easy for them by being reasonable and by offering them the information that they need at the pace and at the tone that people are going to respond to you. And it's no different from someone questioning you in your role. If someone puts your back up, you're not going to give them the best response. Deal with your doctor the same way. The bit that's difficult is if they just don't believe about fibromyalgia at all. Now, what I would do in that situation, if I was faced with a colleague who said, I don't believe in it, I would gently remind them that fibromyalgia is an accepted diagnosis in ICD-11 and that there is good evidence that there is epigenetic change, meaning your genes change as you develop the problem, that it's accepted that it affects 5% of the female population and 1% of the male population, and that it is something that if they know nothing about, although it's difficult to hear, they need to go and inform themselves about it. And I think if you say that politely and nicely and kindly, that's a reasonable thing to do. You can, in fact, refer them to the resources I produced on YouTube, which talk about fibromyalgia and talk about the epigenetics of it, central sensitization, the way that it can develop, how it develops in people, the fact that you're usually having childhood trauma with adult provocation, and that it goes alongside issues with mental health. It goes alongside anxiety and depression. And in my opinion, isn't caused by that, but associated with that. It can be made worse by the drugs that we give people. It could be made worse by the health interactions and the feeling of isolation and othering. And that fibromyalgia can be managed, but it needs a sympathetic medical system to understand what they're offering you and encourage you to manage what is a chronic disease, which can be very intrusive. And I think if you put it that way and explain to people that just saying it doesn't exist isn't reasonable, but you say that nicely and gently nudge them towards further information, they will respond to you. A decent doctor will respond to you. And I think it's absolutely reasonable nowadays for doctors to understand what central pain is and why people and 5% of the female population have central pain. I don't think that's an unreasonable ask. So ultimately, if you are ignored, then the hospital and the clinical service does have a complaints process, but I would caution you about going down that road because that only makes matters worse. So really, if you get into the situation where you feel you're not being believed, the best thing to do is to gently go and maybe speak to another doctor, another nurse, a different member of the service and explain your concern. And if you explain concerns to people and you explain why you're feeling unhappy and unlistened to, then normally I would expect even if one clinician's had an off day, another clinician will be sympathetic and responsive and will sort the problem out. There will always be nurses around when a doctor's doing consultation. There will always be doctors around when other people are doing consultations. It's a multidisciplinary team. The whole purpose of a multidisciplinary team is they support each other and they're there to support you. So go and talk to other people. Don't get aggressive. Don't be mean. Don't threaten. Just say, look, I wasn't listened to. I feel like I've got these things that I don't understand. Please help me. And people will help you. They all go to work to look after you and to help you.